How do digital technologies connect people
to their care teams?
The MoTHer platform is a platform to support the management of gestational diabetes. We use a smartphone application and a web-based dashboard for clinicians. Mums are able to use the app to log their sugars, and then the sugars go to the dashboard and clinicians are able to look at those sugars remotely. The feedback for MoTHer and the mobile technologies that we've had in general has been awesome. I really relate to the MoTHer platform because I'm a mum myself, so I've got 2 boys, and one of which was premature, so he was 10 weeks early, and I'm a public health scientist, but I get to work with incredible people that are experts in technology, and then I try and bring kind of the human patient experience side to it. So that collaboration is what gets me really excited. You know, when we put all of our brains together, I think that's when the magic happens.
Dementia Aged Care Services Project, or DACS, is one of our projects to validate and evaluate one of our platforms called Smarter Safer Home to help older adults live independently longer. We use environmental sensors, wireless sensors that can monitor their mobility in their house, their meal preparation activities, any kind of activities that are related to daily living. That can tell the care team how well these older people are functioning on a daily basis or if they are declining. So that can be an early indicator if they need support. The use of technology in care situation is really exciting for me because I think it shows how technology can help humans. I live quite far from my immediate family, but I have my sister living here who gave birth to her first child. And I felt that I really need to support and care for her during that time. We are putting our mind and heart to developing these kind of technologies based on people's needs.
CSIRO were commissioned to work with the NDIS to develop a framework that would help people with lived experience of disability and also developers developing assistive technologies. We particularly are looking at assistive technologies that use artificial intelligence. The 6 domains that we used as part of the framework were user experience, human rights, relative value, safety, quality, privacy and security. We were able to work very extensively with people with disability, and all of them pointed at a number of things that were of concern or challenges. This body of work really was developing a piece of information that really educated people to actually see what they needed to know and how do they make a choice, or how does a developer know what they need to consider when they're developing a technology. Seeing what this produced at the end and how important it could be to people making their own choices, to be more independent, have higher levels of dignity. I saw the impact of that as really very significant. I have a cousin who I've grown up very close to. She this year had a year full of grief. I very much feel that the care that I can provide her with now as someone I've always admired so much is really supporting her and her family. And I know in my own life, things that we do at work, I'll think, oh, I need to think about that. This isn't just for someone with, a problem that we've defined. This is for everyone.
How do digital technologies connect people
People to their care teams?
That's how.
That's how.